We be connected with Dr. Danang Wahyudi, a dermatovenerologist at the MNC Hospital. Good morning, Doc. Thank you for joining us today's program. Your job title couldn't be any longer.
Thank you very much.
Definitely butchered it. So let's get started. What could be the main causes of alopecia areata? We do know that we have read that it's partly caused by stress, but is this hereditary? Can this be passed down to our children? Can you tell us a little bit more about it?
Okay, yes. So this is the disease that you must know that this disease is a chronic relapsing disease. So it comes and goes. So the main impairment is from the quality of life actually,
Oh,
and
okay.
it can it can cause women and a man with the same percentage, and also it can affect children and also adults too. Mostly they are like the name itself. The alopecia is the hair loss. Areata is patches. So alopecia areata is patches hair loss in
Okay.
the head. So 80% is like that, like the pictures that you see here. But the aggressive disease is that it can be also be totalist, that all your hair are affected by it, so it not grow the hair, and also it can be what you call alopecia totalis, when all the hair in your body is affected by it and not grow.
Okay.
So it actually affect the autoimmune is affected in the hair cycle. So there's three hair cycle: the growth cycle that we call anagen, and then there's resting cycle, the telogen, and the catagen. Then the the anagen should be 6 period, but in the event of alopecia, it only had a 4. So it's not, it's forced to shed uh, more fast.
Okay.
That's why that cause the hair shedding.
Yeah. Now, Dr.
Yes.
Danang, you were also saying that actually the percentage of, those who are affected with this disease, either both and women, is equally, it has an equal percentage. But it seems, especially
Yes.
from what our colleague Weeby has, pointed out on, celebrities and figures, it seems it's more dominant to women because we know, especially, I mean, if it's for men, if he is, let's say, a baseball athlete, he needs to wear, the protection or the hat, the head protection, right?
hat, yeah.
But for female, especially with us with longer hair, we used to put our hairs in a bun. Sometimes we brush our hair too hard and whatnot.
Right.
Could that be one of the factors, also, doctor?
Yes. There can be from trauma. It also can be from stress, like that celebrity said.
Yeah.
And also it can be genetically heredited. It can be. So if you have a family history of alopecia, then you have more.
Chances.
You can more chances to be alopecia. And also if you are the alopecia is the in the young age,
Yeah.
then it tend to be more severe.
Oh,
my
really?
goodness.
Why is that, Doc?
Yes. Yeah. If you ask why is that, there's still no answer for that. But that's the
That's how it
statistics.
happens.
The
Yeah.
statistics says that when you are having in the young age, then it can tend to be more severe, tend to be the totalist or the
Oh,
universalist.
goodness.
Oh, okay.
And it makes more sense because when you're younger,
You have more
everything
hair.
should grow, right?
Well,
I mean,
exactly,
it's our
yeah.
growing
Yes.
period
Right.
of time.
Right. So, Doc, what are okay? you know, we as men are always worried about hair loss anyway as we proceed to
Yes.
a more advanced age. So, how can we differentiate hair loss and alopecia? I mean, what are some of the symptoms that we need to look out for in the early stages so we can take the necessary actions? Because if we start going a little bit bald, we could just ignore it. Let's say it happens in a normal spot where men go bald. We'd say, oh, maybe I'm just getting
Yeah.
older and going bald, and we may
Receding
never
hair.
recognize that it's alopecia.
Yeah.
Yeah. So the main baldness is used to be have the area in the top of the head or in the front of the hairline. That's the usual androgenetic alopecia. But in like I said before, in alopecia areata, there's patches.
Okay.
Right.
So
It's
the
random.
spot it's not one, and it's more than one, and not in the usual area.
Okay.
It can be anywhere. And also, but you have to also differentiate the alopecia areata from other diseases like fungal disease, yeah, the infection of the fungus, and also the infection of the systemic bacteria like syphilis. They also can do these patches,
Okay.
almost the same.
Yeah. And it
So
seems.
if you have patches,
Yeah. Go ahead, doctor.
yes, yeah. So if you have any patches, then you should see doctors to
Yes.
examine is it really alopecia areata or there's any other infection beneath it.
Oh, don't worry, doc. If I start losing my hair in any spot, normal or not, I'm definitely going to see a doctor. I'll be
It's
freaking out.
receding. Now, doctor, also when you were saying that there are some certain factors also that we have to see the doctor if it's fungus and whatnot. And it turns out alopecia also has other varieties like alopecia androgenic and frontal fibrosing alopecia. Can you tell us more about
Yes.
this, doctor?
Yeah. So it's not in the same area of the alopecia areata actually.
Mm-hmm.
The androgenetic alopecia it's caused by hormone, and
Okay.
it's more common. Like I said, it's more common when you're age, then the hormone is down, then
Mm.
the hair is shed more. So, and also if it's fibrosing or cicatricial alopecia, it used to be have some other autoimmune disease that can cause the alopecia like lupus
Yeah.
erythematosus.
Mm-hmm.
That's why they call the fibrosing. So it's makes the scar, and it's not reversible.
Oh,
When
okay.
it's alopecia areata, we can still uh, induce the hair to grow more, but in
Mm-hmm.
this cicatrical, the hair shaft is already lost. So
Okay.
we cannot induce it with uh, drugs or something like
Mm-hmm.
that. We have to get rid of the cicatrix and make surgery by it.
Okay, so let's go back to, since you brought it up, alopecia areata, as you said, is at least reversible. We do know that stress is one of the common factors for it. So apart from reducing stress, what are some of the other treatments that can be used to cure or to reverse the effects or the symptoms of alopecia areata?
Yeah, there's a lot of treatment that we can use. We can use the drug called minoxidil. We can use the steroid like injection, and also we know that here there's a low growth factor in the hair in the alopecia, so we can use also the treatment that we call now PRP.
Mm-hmm. Right.
So we inject the growth factor in there to induce the hair. And yeah, there's also other treatment like laser also we can use to induce the hair growth. But actually for alopecia areata, uh, there is no best treatment that can goes more than 50% effectiveness.
Oh, okay.
So that's why uh, it's still a problem for us also dermatologists
Okay, so
to
you can,
treat
if you
alopecia.
you can
Yes.
regain 50%. Perhaps is that why there's so many different treatment types? So perhaps you combine the different treatment
Yes,
types and things of that sort.
yes, yes,
Okay.
yeah.
And you do say that this can
Yeah.
return at any time. So the treatments need to be ongoing, or only if it relapses per se, if the alopecia comes back.
Yes, yes, yeah. In autoimmune disease, we have the term the remission.
Remission, right?
Yeah.
Okay.
So yes, so in this time, remission is the a healthy time before in between two relapsing.
Yeah.
So in this time, sometimes we just have to wait. So in Singapore uh, research, they say within a year, 80% there will be a remission in 80% of the patient.
Oh my goodness. Okay.
So within a year,
Right.
so we still have we can wait. But the thing is, what frustrated the patient is that yes, we have remission in 1 year, but in the other year, the symptoms can be getting back or getting worse. Yeah.
Okay. So we have to be on a lookout at least for that 365 days or 1 year
Yes.
ahead. Now, Doc, a
Yeah.
question. When someone has, let's say, one has comorbidities, can alopecia areata become life-threatening for them?
No, actually,
Okay.
no. Yeah. There's no underlying disease that can cause a death in alopecia,
All right.
as far as I know.
So it's just the physical effect, and
Yes.
also I'm pretty sure it's mentally
Yes.
effect to those that is
Yeah,
prone to
yes,
this
yeah.
disease.
Well, speaking of comorbidities, you know, we've been living with COVID-19 now for the past 2+ years, and vitamin D has been in everybody's medicine cabinets as of
Yes.
lately. We're always trying to get more vitamin D, getting more sun. Does that actually help with hair growth for those with alopecia, Doc?
Yes, actually, about 15 to 70% of alopecia patients have deficiency of vitamin D somewhat, and it's also caused the autoimmune sometimes the deficiency of the vitamin D. So that's why the take intake of vitamin D can make your immune system grow or more effective to deal with this disease.
That makes sense.
Yeah.
So yeah, that's the thing. But other than vitamin D, we also can do vitamin E for helping the
Vitamin
alopecia.
E. All right.
Yes.
So, Doctor, sorry, before we conclude our discussion today, just a very short one. You were saying that one of the big factors of alopecia areata is lifestyle, right? So, how can we, put ourselves in a better, in a better health, so then, we won't be affected with this disease?
So yeah, you just have to be do the healthy lifestyle. Do the sun more, take the vitamin that you need it, and also you also have to manage your stress better
Yes.
and take a good rest. And yeah, actually, the thing that you already know what to do, but sometimes you just cannot. You cannot avoid something that Jakarta is the
Yeah.
stressful city.
Yeah.
Right.
So
But yeah.
yeah,
Yes.
that's the thing.
Managing
happy.
stress, managing stress, and most
Yes.
importantly, getting enough sleep at night. Like people
Yes.
always overlook that.
Yeah.
It's how important your body recovers throughout the night. We're always kind of compromising our sleep for other
Yes.
things. Doc, thank you so much for your time.
Thank you,
That was
Doctor.
Dr.
Yes, you're
Danang
welcome.
Wahyudi, a dermatovenereologist. Did I get it right this time?
Yes.
He's
Yes.
been practicing
Yeah.
under the mask, Doc.
Don't forget about the venereologist.
Thank you, Doc, for your time. Stay
Yes,
safe.
okay.
It's
Have
been
a great day,
talking to you.
Doctor.
Have a
Yeah.
great